Now we have the hyperbaric chamber, a specialized medical environment for precisely controlling pressure and oxygen percentage. Duke Medical Center is the regional referral center in the American Southeast for these specialized hyperbaric medicine therapies. So I'm here in one of Duke's hyperbaric chambers. This is in Duke's hyperbaric and environmental physiology facilities. And I just wanted to show what the environment looks like for receiving these specialized hyperbaric medical treatments. So inside here, we have a large pressurized container, which allows, once all the doors are closed, we can increase the atmospheric pressure experienced by patients sitting in these chairs. That effectively means that we have a lot of room to play with the percent oxygen each person experiences, especially when we're talking about treating, for example, the bends and worrying about those bubbles in the bloodstream coming out of saturation. Well, if we increase the partial pressure outside, those bubbles will fall right back in and stop the dangerous bubbles in the blood. Additionally, we can control the exact percentage of oxygen in these hoods. So right here, one of these hoods, I can turn the oxygen all the way up to 100%. Then on top of that, if we have 2 atmospheres of pressure from the outside environment, that effectively means that the patient's lungs are experiencing 2 whole atmospheres of oxygenation. That can be very helpful, especially if there's any damage to the lungs or other diseases that make it hard to get that proper oxygenation of the lungs and then the capillaries coating the alveoli.